Good afternoon. This is Adrienne Payne-Andrews, and I'd like to welcome you to the Healthy Communities Initiative webinar, Exploring Community Mobilization Together. Before we get started, I have a housekeeping items. All of your phone lines are muted, as with previous webinars, to reduce background noise. Please make sure to use your audio pin so that your lines can be unmuted to participate in discussion. Also, please make sure that your computer speakers are turned off or muted if you have dialed in using your phone. This helps eliminate the background noise. We have posted the webinar slides in response to some of your requests on the HCI SharePoint calendar, so you can print them off if you would like to have them available and take notes during the webinar. They're also located under Resources in the HCI Webinars folder, and we will also send these out after the webinar. We are recording the webinar, and it should be archived on SharePoint within a week or so. We're going to start today with a short slide presentation. We have Amy and Joyce on the line, and time will be set aside for questions and participant discussion throughout the webinar. Please feel free to type any questions that you have in the chat box on the right-hand side of your screen. We also encourage you to send your questions to all participants, not just the organizer, using the drop-down menu so that everyone can see your questions. We will close with announcements and about upcoming events and some due dates, and we expect to be done with the webinar today by 1 p.m. With that, I will go ahead and turn it over to Jeff Usher.
Thanks, Adrienne. Hello, folks. It's good to have you on the phone. The purpose of today's webinar will be to provide a working definition of community mobilization as it relates to community change framework and your policy priorities. To increase understanding of how to activate networks and individuals through mobilization, and to create a networking opportunity for leadership teams to learn from each other and explore ideas together. This will be your work on the phone. So we hope you participate. Please throw out those questions. And I'm going to turn it over to Amy and Joyce.
Hello, everyone. This is Amy. This is Joyce. We're excited to talk with you today about community mobilization. So as most of you are probably aware, community mobilization is one of the 4 pieces of the community change framework that together work to support an environment that supports community health policies. And that's what all of you are working on in your Healthy Communities Initiative. The 4 components work together. In the case of your community, you might be working to create an environment that supports a policy change that will increase access to healthy foods or create a more active community. So Adrienne shared a little bit about what you can expect on the webinar, and Jeff shared a little bit about our purposes. Joyce and I have 3 sections that we'll go through today. Our first section will be some descriptions about what community mobilization is and what it looks like. And then we'll share some examples of community mobilization. This will be second section. And we're eager to get some input from you through the chat box there. Our third time will be some conversation about community mobilization efforts. And then the lines will be unmuted. And so please follow Adrienne's directions to help reduce background noise. So Joyce will share a little bit with us about the definition of community mobilization.
So as you've been experiencing with your grant work to date, you're learning that really in order to mobilize people effectively, it's a really intentional and dynamic process between you and your team and key segments of your community. And it reaches far beyond just educating people about what you're doing to taking purposeful action. And when we talk about key segments of the community, we're talking about potentially influential groups or individuals, which could be your government policymakers and organization decision makers. We're also thinking about other formal and informal leaders. And another key segment of your community is those citizens who will benefit from the changes that you make. And this is a process that's grounded in the local concerns of your community and where you're finding energy in your community to create that desired change. And the process also empowers and ensures that there's local ownership of the work that leads to greater sustainability and impact over time.
So what does community mobilization look like? You might be thinking in your communities about those folks who are involved closely in your coalition work. You have a leadership team. You might have some coalition members that are the next layer out. You might have some interested community members who help with your work. One way to help think about who is doing community mobilization in your area is to think about the different roles that people who are working with you might be playing. Some of the folks might be attenders. Those are folks who come to meetings, they're physically present, they're interested in knowing what's going on, but they don't do much outside of attending meetings. You might have some folks in your community who are learners. They are interested in learning about the targeted topics. If any of you are on the webinar today, hello and welcome. We're excited that you're a part of this. The next level or layer might be some folks who are responders. And those are the people in your community who are willing to respond to requests to take targeted action. So what does targeted action mean? These might be including sharing healthy activity education articles or sharing information in their communications that their organization or efforts send out to people. These might be folks who are willing to do things like contact organizational leaders to communicate what matters to them when it comes to policy. Or they might be willing to talk to policymakers about what's important to them and their policy priorities. Targeted actions might include as well providing information to the media about healthy activities or policy changes that are important. Or they might be some of your organizer folks, those who help organize events, ask participants to give feedback, that sort of thing. So whether it's responders, actors, or mobilizers, these are folks who are helping you take targeted action. Actors are folks who independently initiate targeted action. And then mobilizers are those who invite others to take action. So it's kind of like layers or ripples. We put them in something of an order. I find sometimes your responders and actors could look pretty similar. And then sometimes when it comes to actors, one of your challenges is to track all the good things that they're doing. If things are independently initiated, but you think they're connected to your efforts, that can be a challenge to track. So those are just some roles we wanted to share with you about the helpful framework, and we're happy to entertain questions about that later on.
So in the next few slides, we're going to walk through some community mobilization examples, and in the first two, we'll offer some ideas of our own first. The webinar team put together some ideas, potential ideas of what you might be doing in your community. In the last three examples, we would like for you to type into the chat box your own ideas about what could happen in each scenario. So we'll give you the initial pre-work, what we're calling pre-work, and then ask for your input as we go along. So let's play with this outline of how we're going to do the work with an example. In our first example, let's suggest that your leadership team has been given the opportunity to educate a group in your community that's responsible for the local community garden. And what you're going to talk with them about is the development of a new food policy council. So during your presentation, you ask them to spread the word and begin talking with other key stakeholders about this new development. You'll know community mobilization is happening when those group members actually do start to carry your message forward to other people. Maybe they talk with their local grocer, folks at Extension, etc. And perhaps in addition, they begin a regular practice of sharing ideas about policies with the Food Policy Council once it gets formed. So you have members of this garden group who might be passionate enough to really apply what they're learning and maybe even be on the Policy Council themselves in the future. So that's one example of what community mobilization might look like.
And here's another example. This is our second example, and it relates to active living. So in this case, the pre-work, the work that your leadership team is deciding to sponsor a 5K walk or run, and you're clear about your purpose here. Your purpose is to promote awareness of a master bike or pedestrian plan. So here's the ask. At the walk, maybe you have a booth at the finish line or in the runner's village, and you have a sign-up sheet with email addresses so you can get people connected with your info. You let them know about your upcoming open house for your master bike or walk plan. And then your specific ask is that they themselves, the folks coming up to your booth, you want them to organize a walk audit in their neighborhood, and you ask them to let you know about it when it happens. So then you do all that pre-work, and you see community mobilization happen when the community organized walk audit occurs. So that's example 2.
So let's have some fun together with what community mobilization might look like with some other potential pre-work. So we would like to hear your ideas about the next 3 examples that we give you. And you're going to share those ideas in the chat box. So we'll be able to see and help each other with ideas about how to do mobilization. In this first example, your leadership team is invited to update the local Chamber of Commerce on the progress of your master bike and pedestrian plan. And during the update, obviously you have a captive audience, and they're interested in, and you're interested in mobilizing the chamber members. So as a leadership team, what might your ask of the chamber be that could lead to mobilization? So let's hear your ideas. Type in any thoughts that you have about what your ask of the chamber would be. So one idea I'm seeing so far is that you might ask the chamber to spread the word through their own newsletter so that the community could be more aware and probably touch more people. Another one you might be seeing is asking the chamber members to tell all of the respective organizations that they work for about the plan. Great. Offer a discount on breakfast to members of the chamber. Cool. Organizing more events that promote the paths and the trails. Great. So wouldn't it be nice if your chamber is actually doing that work and it's not your leadership team that's having to do that work? Those are great examples. So when you make that ask, then what are possibilities of what community mobilization might actually look like? Let's hear some of your ideas. It may be a follow-through with exactly what your ask was. How else would you know that community mobilization is happening? So I'm seeing letters to the editor about the plan, so you know your community is curious. I'm seeing that people are actually participating in the events that the chamber puts on. Businesses respond to that ask in ways to get involved. Offering discounts on memberships to businesses that install bike racks outside their business. That's great. There's a clear message if you see something like that happening, that a business values that. And then work sites sign a letter of support to send to the City Commission. Great. So those are all great examples of what community mobilization could look like. Our team, in putting this together, thought that our app might be identifying how they could demonstrate support for the plan, and then the chamber actually writes a letter of support for that plan, and somebody, maybe it was somebody in the community that has that exact bike rack that we have on our slide. But yeah, so one of the businesses adds a bike rack in front of their business. as a way to encourage people to think about riding their bikes.
Great, thanks for those excellent examples. Here is example number 4. This is another one where we're interested in hearing your ideas. So in this case, we are thinking about a community that's working on healthy vending and concessions options. So the pre-work is that the leadership team is educating key stakeholders about new healthy vending and concessions options. And so the leadership team is thinking, what are some of our asks that we can ask key stakeholders to do? So again, in the chat box, tell us, what do you think this leadership team could ask of their community's key stakeholders? Key stakeholders in this case might be somebody who runs the organization where the vending or concessions are located. Might be the most common consumers of items from the vending or concessions. Might be the coordinators of the activities that happen in those locations. So what could the leadership team ask key stakeholders to do? So we're seeing an example. It says one idea might be to stock at least 30% healthy items in vending or concessions. Renee, you found the box. That is the comment box to respond to. Very good. Another example is to write an article in the local paper. So you might be asking a key stakeholder in that case to write an article or share an article with their local media related to either the process of choosing new vending items or the process of thinking about how concessions could be healthier. Excellent. Any other ideas? Okay. Well, let's think about what community mobilization might look like in this case. Oh, one more idea. The ask could be to ask coaches to get kids involved by staffing a taste test with new products at an event. Cool ask. Great. So what does the community mobilization look like? And these could follow on from the asks that you mentioned. So the question here is about the next steps that your leadership team would take. You have educated your community about new healthy vending and concessions options. You've identified your clear ask and you've made it. The question here is, when do you know that community mobilization has happened? So I'm responding to a question that said, I'm not real clear what question you're asking, Amy. So the question I'm asking is, what could community mobilization look like? We have a suggestion that the community mobilization happens when community members select the healthy options provided in vending and concessions. Exactly right. When people outside of your leadership team, when the key stakeholders select the healthy options provided, that is community mobilization. Other ideas? Great. So another example is when stakeholders that you've asked your clear request of, they also talk to other businesses about the value of healthy vending. Another thought is that the school district would then adopt a policy that states at least 3 healthy options will be at every concession event. And another thought, local business as a healthy vending machine for healthy options. Good thinking, everybody.
Let's try one more example. We really like for you to have your thinking caps on to help each other out with possibilities. So in this example, your team decides to send a press release to the media about safe routes to school and a planned activity you have around that. So what would you ask the press to do? What's your thoughts there? What would you ask the press to do with that? Get creative on this one too. It's not just about, the only option isn't just about publishing something or putting an article out. So the press might be out there interviewing people, getting some of the stories that are really important to helping people understand your initiative. What else could they do? What else might your ask be, I guess? Get the cameras out there. Great. Again, recording the stories, recording people involved, impact. You could ask the press to be even more active on social media or on their TV stations. You could ask the press to work with the students, maybe get their ideas about improving safety on the school grounds or even in their path to get to the school. So great. And then community mobilization, you're giving us some ideas already about what that could look like, or how do you know when the community is mobilized around this issue. So how would you know that what the media has done is then mobilizing people? So one way is that you might have a walk and talk with kids on their routes to see what's safe. What do the kids think about the routes that they take to and from school? Maybe the kids have a specific way that they want to give that input back to your leadership team or to the school board. Another great example is the community's been mobilizing. The school board and the city are working together to look at these paths or the safety conditions around the schools or the paths to the schools. So in our example, we thought just about that your ask was to cover the event in some way, and simply they could cover the activity, which also, if you think about it, could be a reportable community education piece. And then perhaps after reading the story that they've put in the newspaper or covered in the news, that the parents might actually initiate a school walking bus on their own accord, or the parents get involved in trying to look at safety issues for their own children in getting to and from school.
So that was the end of our second part, where we're thinking about examples of community mobilization. Thank you, everybody, for using the question and chat boxes to connect with us. That was really helpful. So we are going to move to our third section, which is the start of our conversation with communities. We're going to start by hearing from a couple of communities. We've invited the folks working in Douglas County, or where Lawrence is, to share a little bit about community mobilization in their community. They're working on access to healthy foods. We are also going to hear from the group in Seward County, where Liberal is. They're also working on access to healthy foods. So Charlie Bryan will be sharing with us from Lawrence, and Susan Laguago will share with us from Liberal.
If Charlie is on the phone or on someone else's line, because we don't see him in the list, if you could type in the chat box, Charlie, who we should unmute, we will do that.
Okay. Susan, would you be interested in sharing a little bit about what you're doing in Liberal, since we can unmute you and interact with you first?
Sure, I'm glad to. And I was going to go ahead and use sort of the guideline, if I could, that Vicki had shared with us, and then if there's some other questions and things that people would like to know, we can do that. But what I put together to share was a question of, like, how do we know when people in our community are mobilized? And this is sort of variation on Amy's definition, but basically we know when people are mobilized when folks other than those who are directly involved in the Healthy Communities Initiative talk about it with third parties, or especially when these folks talk about it like it's their own, like they take ownership of it. And so here in LeBron in Seward County, what it looks like, specifically in what we've been working on during the planning year, is we started working with the Parks and Rec Department here in Liberal, and the director of the Parks and Rec Department is a gentleman called William Weber. And what started as a conversation of, you know what, this looks like something that, you know, that's something that you might be interested in. Would you want to talk about it? He said yes. He followed up with a conversation of narrowing it down, because the Parks and Rec does physical activity and nutrition and other activities with kids. We narrowed it down to a healthy eating focus area, and William was very, and continues to be very enthusiastic about healthy vending. But where we get into even a little further, if I can just go through the path to the mobilization part, is that he chose to, when we came up to the time of having a nutrition standards training, he voluntarily went and talked with our commissioners and his superiors, got permission to go to the nutrition standards training. And then while he was there, unbeknownst to Sarah and I, who are on the leadership team, he went and talked with Vicki and Claudia and had a very extensive conversation with them. And we didn't even know about this, and continued talking about healthy vending with his staff, okay, William's own staff at the Parks and Rec. We didn't know this until we got to the point of doing an activity, a taste testing with the kids, who will be the end point of healthy vending. When we got to the point of doing that program, the taste testing, we learned that he'd been having meetings with his staff and talking to other people about the healthy vending initiative, like it was like his own activity. And that was just, we feel like that's really the embodiment of mobilization of this particular initiative. And we're proud to share it. We're proud to share that. And yeah, there were, I mean, I don't know if you want me to stop talking, but we also had a couple of questions about, like, maybe what we found challenging and what has been most successful and the next step. Shall I talk about those, or shall I stop for now?
Yes, I want to observe that one of the things you said was that community mobilization was happening unbeknownst to us. That really stands out to me, and that it was through your further work in the community that you almost came to realize somebody had been mobilized. So that's interesting. So yeah, that is our next question. What about mobilizing others has challenged you most?
Yeah, I think, and Sarah, who's the other co-coordinator, is on the call, and I know she's not unmuted, but maybe, Sarah, if you have something to say, I know you'll put it in the chat box. But I think I wrote down like 3 things that have been challenging. One is explaining the difference between policy and program. You know, so even with William, and then as we've gone a step further, we're looking at a couple areas, but explaining the difference between policy and program has been challenging. That's the first thing. Secondly, looking at long-term commitment, that this is not something that's going to happen one time and then it's done, but that policy change, mobilizing the community takes time. That has been challenging. And then the third thing is completely not new, which is convincing folks that they do not have to wait for the core team to do or say something or to lead. That you once you understand, or you feel like you understand, and really you can't go wrong. Go ahead and take the initiative, and that has been a challenge as well. So it's those 3 things.
Thank you for sharing those challenges. I bet a lot of communities can relate to those, that it's difficult to explain the difference between policy and programs. It's hard to help people understand that this will take time, and you're trying to get the message across that they don't have to wait, that they can go ahead and take the initiative. Thanks for sharing those challenges. So what has been successful for you in overcoming those challenges?
Actually, which maybe this is a common thing, certainly in the United States, but maybe in the whole world, I don't know. But when we have programs or policy changes that are regarding children, wow, that's like maybe children and animals, but in this case, we're talking about children. It seems like there is more likely to be support and around mobilization for children. And in our community, we've seen that around physical activity, nutrition, and then also just a little to the side, breastfeeding support. But we've found that mobilization efforts around those issues have been successful. And then the second thing is if and when there is already a champion around a particular issue, then it's almost like maybe this is the mobilization almost happens by itself, which is when you find out that things are happening unbeknownst to you. You know, when they're champions already, not just even in the first layer, but in the I've forgotten, like in the learners, and then onto the mobilizers. I forgot what the third one was. But when there are all of those along the way in all those layers, then it just kind of runs away, which is great.
That's great, Susan. Thank you for sharing that. So what are you thinking about for your next steps in your community around community mobilization?
We're thinking there are 3 things. First, we found that hopefully giving people a choice from a menu of ways to mobilize others, if you will, can be helpful in maybe choosing, maybe in a concrete way, seeing a choice of something to do, and also perhaps sparking the idea for moving forward. So, like, if I may say, like how you in the presentation you helped us with just right now, when you showed us some examples, and then we could move forward from there. I think we found that's what we plan to do as well, giving people a choice. Like when we go into the mobilize the media and that sort of thing. We've got some specific ideas to help get things moving. The second thing is asking specifically what you can do, as opposed to waiting and hoping. So I'm more comfortable maybe writing something or talking to this person, as opposed to another person who will be comfortable doing a presentation. So they can tell us what they can do. And then thirdly, sharing the goals for our community. Sharing the goals for our community with specific groups and asking what each of them can do. So like civic organizations, legislative organizations. So sharing with specific groups and asking each of them what they can do in the area of mobilization. I don't know. I know that doesn't sound very clear, but those are the three things we've written down.
Thank you for those thoughts, Susan. That third one that you said about sharing the goals for your community, to me that speaks to your vision and reminding folks of what your vision and purpose is. And so speaking to that purpose is an excellent leadership skill that you're demonstrating and planning to demonstrate. And I like your idea, too, of having a menu. Here are some ways that you could take action, almost like a drop-down menu, where in the modern age, right, we like our drop-down menus. That's a way for people to choose from several options. And then I love this second idea you shared, where you're checking in with the folks you're trying to mobilize. What would you like to do? What's more comfortable for you, and hearing from them. So excellent suggestion. Thank you so much for sharing your example from Local. We appreciate that very much.
You're welcome. Thank you.
Thank you. So we weren't able to connect with Charlie, but we have Jeff Usher here.
Yeah, I was just thinking about an example from a kind of a bigger national perspective. As many of you know, that the Kansas Health Foundation, we actually have nutrition standards for all meetings and all food for our staff. And thanks to Vicki and Claudia for helping us design those nutrition standards. And we also, as a result of that, thought, maybe we should put part of our grant agreements that our funds will not be used to purchase unhealthy foods, and encouraging people to do that. Well, someone nationally heard about us doing that. The Center for the Center for Science and the Public Interest, and they have nutrition is a big area they want to focus on. And so they heard about that, and they called me last week. And in the conversation, they were saying, we would really like other foundations to do the same thing. Would you be willing to sign a letter with us that will go out to health foundations across the nation, using you as an example of what they could do to really increase healthy meetings and healthy environments with their grantees and with themselves. So I just thought, as we were talking, she just sent me the letter, and as we were talking, I'm thinking, well, this is an example of how someone nationally is wanting to impact nutrition standards in meetings and in place. So that's just an example.
So let's connect the dots. So we have this framework of there being some pre-work, a clear ask, and community mobilization. So what I hear you sharing, Jeff, is that the pre-work is your organization setting a policy and attaching that policy to your grant funding agreement. That's some of the pre-work. The clear ask came from outside. It was the Center for Science and the Public Interest, and they clearly asked you, will you send a letter to all foundations?
Right. And so, yeah.
So when does community mobilization happen?
Is when we sign the letter.
Is when you sign and send the letter.
And so and the letter will come from us and from the Center for Science and Public Interest to all health foundations. So I guess an example of a strategy is in what they did. So their pre-work was they were probably having conversations somewhere in Washington and saying, how might we think of ways we can move these policies in foundations and elsewhere. I'm sure they're thinking of other places. and they're probably looking at industry. They're probably looking at associations of some sort. And so what they've done is, I'm just making an assumption. So what they probably have done is that as a strategy, they're saying, let's highlight those who are already doing it. So that would be a solid example of how you might, in your communities, highlight if there's a policy priority and you know someone in your community who is doing that work, or maybe it is someone from another community who can influence a sector in your community. So basically, you look for who's doing the work and highlighting that and asking them to share with you, because it's easy. It's easy for us to say, "Oh, sure, we'll do it," because well, guess what? We're proud of that. And so that's just an example.
Great, great, thank you.
And it's also a means that, because one of the things I think we've heard from Susan especially, and I've heard this from others, it's hard to track your community mobilization. And if you're doing it right, guess what? You're not going to be able to track it all. But we want it, doing something, an ask like we just demonstrated, is a clear way of being able to track it. Because you made the ask, you've asked them to share a signature, and then if that signature is signed, you certainly know what's happened.
Great. So we are opening lines now. We are unmuting everybody's line, and I'll turn it over to Joyce to lead us through some discussion questions.
Yeah, so as you're being unmuted, I just want you to be aware of your background and any potential noise that's in the area. We'd appreciate it if you can physically mute your own line if you aren't talking, just so that we can cut down on background noise. So somebody, for example, right now, we can hear, so you might want to mute yourself until you're ready to speak. You were all sent a series of questions that we just walked through with Susan. You were sent those questions as pre-work to think about prior to the webinar. And we would really like to have a forum right now where you can educate each other about what you're finding in your own community. The first question that you were asked was, what does community mobilization look like in your community? And so if you would like to unmute yourself, then we'd really love to hear what are some examples of community mobilization and what it looks like in your community. And don't worry if you don't feel like it's a huge community mobilization. It could be something that you consider to be maybe a smaller piece to something that's big. So Jeff gave us kind of a more national example. It doesn't have to be that big, obviously. I know you all have been working. What are some things that you have, some outcomes that you're at?
Joyce, this is Lynn with Barton County.
Hi, Lynn.
And we asked our high school students during a community service day to do a walking audit for us. So we had 60 students that did that walking audit in Great Bend. And since then, they have mobilized and turned around, and we received several pictures back during that time from their phones. But I have also received emails in the last week from students that have continued to take pictures of areas in during that walking audit of things that they saw, trouble spots, or things that they were concerned about.
So did you seek out the high school students specifically? I'm just curious.
We did their sponsor, yes.
Okay. And then I assume there was some education to them about what a walk audit looks like.
We actually gave them a form about with different items to look at from a walk audit.
Okay, so that was some of your pre-work, with some of the education, helping them understand the concept and perhaps what was important about it. And then they were motivated to follow through. There was something that was interesting to them about it. And so one of the ways you knew that community mobilization happened is they actually did the audit and they sent you photographs.
Correct.
Which is very cool. So the continued emails you're getting, are for other photographs. What are the things that are interesting these students that they're taking pictures of?
Some of the pictures have been of areas that they thought were streets that had very aggressive drivers, that they would be scared. We had one family that did a bike ride. Their high school student had some younger siblings, and so they went out on a bike ride and were discussing areas that they were concerned about. They thought, well, I don't know if we'd like to ride this area. Another one went through one of our parks and was commenting on some of the entrances and exits from the park.
Great. Great. Anybody else? What else does community mobilization look like in your community?
This is Michelle from Dickinson County. Can you hear me?
Hi, Michelle.
Hi. I just wanted to, I guess, explain. We had a reporter come to one of our Health and Wellness Coalition meetings. I invited her. I had invited her, but not because she was a reporter, just because she's an active fitness member in our community. And what came out of that was there was a story 2 days later in our paper about our active transportation and what we're trying to accomplish. So that was exciting for our coalition.
Right. So she was mobilized to come to the meeting that it sounds like was very interested in your targeted actions, the things that you were really wanting to do for educating your community.
Yeah.
And independently then decided to go ahead and write that article.
Yeah.
Thanks, Michelle. Any more? One more, especially if you think, well, this was kind of a creative mobilization, or maybe even something you didn't expect to have happen, but it did. Okay, well, let's move on to the next question that you received.
The next question was, what about mobilizing others has challenged you the most? We heard from Susan earlier that it's challenging to describe the difference between policy and programs. It's hard to explain how things will take time. It's a long-term effort. And also that it's, there was one other idea she had, that it was that they don't have to wait for the leadership team to act, that people can take action on their own. What else about mobilizing others has challenged you? Well, maybe it's easy for most communities to mobilize others. That would be good news. One of the challenges that Susan described and we've chatted a little bit about is that it's hard to know when community mobilization happens. Has anybody had creative ways of hearing about what's going on in your community, or how to hear that community mobilization has happened? Okay, well maybe we'll hear a story about that from somebody later. Let's move to the third question.
So your third question is, what mobilization efforts have you found to be most successful in your community? And I think what we're hitting on here is not necessarily what did those people do who were mobilized, but what were you doing that got the mobilization to happen? So maybe what were some of your best asks, or what was some of your best pre-work that ended up in mobilization happening in your community?
It's Michelle again.
Hi, Michelle.
Hi. The pre-work that we've done, I guess, is we have this Healthy Hero project, and what it is our coalition nominates somebody in our community that they feel that is trying to try to live a healthy lifestyle, and then we recognize them on Facebook and in the paper. And so we had that in April. We have one a month. And our April one got so many likes on Facebook that our percentage of people, I guess, looking at our Facebook page went up 15,000%.
Wow.
So, and we had people commenting on it that I am fairly new to the community. I didn't know who they were, but it has gained, I guess, that mobilization. And so people are actually talking about it within our community.
Yeah.
And it was in the paper last Tuesday, too.
So what do you attribute that kind of success to?
Well, the Healthy Hero, I think he's well known around town. He's an avid bicyclist, and he ultimately wants bike lanes. We don't have bike lanes in our town, and so he's going to be a good advocate for us. And so he has joined our Health and Wellness Coalition as of our next meeting he will be at. But he's joined our steering committee for active transportation, and so I think it's just been a good success for us.
So it sounds like you chose well initially. Somebody that had connections and relationships in your community, and perhaps somebody that people respected, and who was a great example to highlight. And then I also
a lot of weight, and so that was a good thing to put out there.
It was a good story.
Yeah. A great story, and you use social media, which can have some viral effects to go pretty quickly. So
yes.
Wonderful.
Okay, thank you for that example, Michelle. Appreciate it. So last question, what are your next steps? The community's on the line today. What are you thinking about doing next to mobilize others to help you make progress on your policy priorities?
Well, this is Jeff, and I'll speak on behalf of my role as a member of a leadership team here in Wichita. And it actually goes back to, I think, there's a lot of activity happening in Wichita, and it's been a real challenge, I think, trying to figure out how to report that. And in fact, I would have to call Mim and tell her exactly what she needs to report. So that's part of the challenge. But we of course have chosen the Food Policy Council as a policy priority, and we've been really educating people about it a lot. And what I have done is I've made personal connections with others that are going to be doing activity around Food Policy Council. In particular, I contacted the chair of the HUD Sustainability Planning Healthy to talk to her about possibly using some resources that would look at a food system assessment in the 5-county area that would inform policymakers about the importance of creating a body that could help mobilize people around access and consumption and production of local foods here in the Wichita area. So that's an example of, and I think one of the things that we've talked about, I being in this position on a leadership team and also being responsible for overseeing 20 communities that are doing a variety of different activities, I understand how hard it is to often create the reports that we ask you to report, because I've had these same conversations. We've had the conversations with the leadership team about how we might better track the work. And so I think that's something that as you convene your teams, your steering committees, your leadership teams, whatever, talk about how, what activities, exactly these next steps, and saying if you say, if Jeff Usher says, I'm going to contact so-and-so, how are we going to notify the staff person who's responsible for filling out these semi-monthly reporting forms to make sure it's reported?
So thinking of ways to connect that feedback loop back to the person reporting. Excellent. Thanks for sharing that.
Well, in closing, our purposes today were to really drill down on this behavior of what effective mobilization looks like in a community, and doing that by offering you a working definition and hopefully lots of useful examples and some opportunities to kind of network with those examples about what are you doing in your own community that you're finding to be successful. And we're also hoping that you're seeing that intentional, purposeful act as a part of your work in mobilizing people. I appreciate that Susan gave this idea of maybe even a menu of possible acts so that people can be mobilized in ways that best fit who they are and maybe where they work. So we appreciate that. And thank you for all your thoughts and both in the chat room and verbally in the discussion card.
So we have some suggestions and ideas for concrete next steps that you and your communities might think about. So tomorrow, May 15th, is the last day for entering items on your semi-monthly tracking form for this period, and that will cover activities in March and April. So considering what you've heard on this webinar today, you might like to review those. How has what you learned today changed what you consider community mobilization, and how can you use the items you're asked to report on as a way to help you organize your work? We also encourage you to think about the webinar today and consider how you could use your follow-up TA calls or site visits, anything coming up, to help you continue to think about community mobilization. So I will hand it over now to Adrienne for the last item.
Great. Thank you, Amy. Just a reminder that the webinar recording will be posted on SharePoint within the next several days. And also, I'm going to be sending out an email link to a short survey about the webinar. We so appreciated the feedback from the past webinar and used that to help develop this one. So we really do take the information and use it and appreciate the time that it takes for you to fill that out. Hopefully it doesn't take too much of your time. Another reminder about the grocery store summit coming up on June 9th and 10th. Please register using the instructions that Vicki provided you in an email. If you have any questions, please contact Vicki. As you know, the Kansas Health Foundation will support up to 3 people to attend. Also, Vicki will be sending out a 3-question survey before the end of the week to key contacts for all of the HCI teams about the summit. Finally, a reminder about the 2014 Kansas Health Foundation Health Symposium on June 5th and 6th. It's entitled From Complexity to Simplicity. So please check that out on their website and register. That's all from me. Sean?
Yes, and I just wanted to say a special thank you to Amy and Joyce for today's presentation. I mean, we know it takes a lot of work to put all of this together and realize it's very beneficial for the team. And just to thank you all for joining us for today's webinar. We know this work is dynamic, so it's very exciting to hear about what's happening in your community and how you're mobilizing. So thank you so much, and enjoy the rest of your day.